Good morning. Now I'm going to tell you the bad news, because now we're going to look forward. And because I have been a futurist for a few years, I spend every day trying to figure out where in the world is the world going, and where should it go, and how do we get to go there. So I'm going to give you some different perspectives. First off, as you've heard before, how do you relate to people telling them how serious diabetes is? Children born in the 21st century, meaning my grandkids, your kids, have overall about a 1 in 3 chance of getting diabetes. They have about a 1 in 2 chance of getting obesity. It ends up, if you're a minority, it's higher. If you're a girl, it's about 40%. And we're concerned because this is happening earlier, so that we're going to see disability occurring during prime working years. And there's real concern, now backed up by numbers, that life expectancy might be declining in parts of our country. And that's another thing we worry about. But these are numbers. Now let me show you what's really going on. This is what's happened in the last few months. We've identified overweight 3-year-olds who already have signs of cardiovascular disease. Some of these are amazing. Kind of funny, I have to look at the angle worse than you guys have. About 50% of adolescents have at least 3 out of 7 major risk factors for heart disease, already as kids. Actually, close to 27% of all the children in this country have a chronic condition. Amazing. You remember what it was like in the old days, some of you. Nowadays, adolescent girls, 30% of them don't even get 1 hour of physical activity any day during the week. It shows what a sedentary lifestyle is. 17% of our kids are obese already. Now, the diabetes is kind of interesting. The youngest case I've heard of type 2 diabetes was a 2-year-old. If you're an African American or a Hispanic American child and develop diabetes, there's a 50% chance that's type 2 diabetes. Something that was called adult onset diabetes, something that you saw late in life. Now we're seeing it in adolescents and even younger kids. If this stuff is happening to our kids, what does that mean for the rest of their lives? See, what's going on is it's not one disease, it's all kinds of diseases. It's obesity, it's high blood sugar, it's inflammation of the arteries, it's changes in your kidneys, in your brain and everything else. It's cumulative. It just keeps progressing. So now we're beginning to see changes in young kids, and we know what the impact's going to be during the rest of their lives if we don't do something different than what we're doing right now. Got good news for you. This is last week's data. It looks like in 2030, only 41% of all the adults in America are going to be obese. That's because it looks like maybe the increase in obesity is beginning to level off. Don't know for sure, but we used to think it was going to be over half. But the bottom number, which is right here, is kind of interesting. Look at between 2010 and 2030, the incidence of severe obesity, this is about 100 pounds overweight or more, is going to go up 130%. So clearly, we're becoming a bigger and bigger society. We know it because we don't even recognize it anymore. Everybody looks normal. Until you look at the pictures taken in the 1940s and you realize that nobody is normal anymore. This is what's going on with diabetes in our country. Now, you people understand numbers are numbers. They're approximations. These are CDC numbers. They're different from other CDC numbers. These are from an ongoing study projecting the future. Two things are interesting. Number one is every state is different. And as a matter of fact, if you look at the county maps in your state, you see that every county is different. But you can see clearly that all across the country it's increasing, especially in the southeast. The other thing is if things don't change, 53 million Americans are going to have diabetes in 2025. This is what's going on with the cost. This is total cost. 2025, it's possible that we're going to be spending over $500 billion a year in this country on diabetes alone. Now, that's becoming big numbers. I mean, it's hard to wrap your mind around $1 billion, $1 trillion. Even in Washington, that's a big number. And the other thing that's interesting is you can see 10 states of the country represent 60% of the costs. The biggest, obviously, is California, where in 2025 we're going to spend about $64 billion. You also see Texas, Florida, and New York, very big states as far as cost of diabetes. Taking a look at California, the numbers and the projections, right now close to 4 million have diabetes, going up to 6.5. That's a 70% increase between 2010 and 2025. Look at the cost. Look at the number of people with prediabetes. Now, we talked about major complications. In California, a couple of years ago, about 440,000 had visual impairment because of their diabetes. Well over 6,000 had to start dialysis because of renal failure. About 9,000 had an amputation because of complications of their diabetes. Almost every minority group has a significantly increased risk of developing diabetes, of having complications from diabetes, of dying earlier, prematurely because of their diabetes. Looking at California, you've got 300,000 African Americans with diabetes. And because of the large Hispanic Latino population, almost 1.5 million have diabetes, and even 60,000 Native Americans in this state. Now, just to show you another one, this is what a big metropolitan area looks like. And of course, this is one of the biggest in the country. But look at what the impact is on Los Angeles alone. Right now, about $12 billion a year spent on diabetes, going up to $20 billion. In the back, there are brochures, or actually workbooks, that show what's going on in various states. And you'll see the website at the end, but if you go to our website, you can find out for your state what is going on between 2010 and 2025. What about seniors, Native Americans, whatever, it's all in there. And we've got about 15 metropolitan areas now. Now, got to not leave people like me out, seniors. California's got about 4.4 million seniors. 862,000 of them have diabetes and know about it. There's another 300,000 who have diabetes and it's never been diagnosed. But here's the amazing number. There's another 2 million in this state who have prediabetes, and most of them don't know about it. So if you add up the numbers, that means the people that don't know they have it, and the people that have prediabetes, and most don't know they have it, that means you've got 2.5 million seniors in this state alone who desperately need to have a simple blood test to find out if they're at risk. Now, this sounds like a no-brainer, but still in many states, now this is even more impressive. Once you get to be 65, if I got a deal for you, you've got a 77% chance of having either prediabetes or diabetes, along with all the other goodies that we've got waiting for you. Medicare pays for screening, and yet still, in most states, about 10% get it. So this is another example. The patients don't, their families don't know that, so they don't ask for it, and the doctor's worried about what you're complaining about, and so they don't think about it. Something as simple as a blood test can make all the difference in the world. Okay, now this is one of these things, I'm going to show you some aha slides, and here's one of them. This is a study done by CDC, one of these modeling things, where they projected out to 2050 what would happen to diabetes. And this is the projection. And you say, well, that's great, it's leveling off. The reason it's leveling off is their model assumes that obesity stops growing in 2004. So with this model, obesity clearly is a pretty important aspect for all the diabetes we have, and so it levels off. You got to start with a baseline somewhere, you know, and if they didn't do that, they just keep climbing. Now let's take a look at some interesting things. First off, we know if we do effective management of diabetes, we can dramatically reduce the risk of these severe complications and improve life expectancy. Well, if these are very modest assumptions, you know, it's a computer model, and they said, okay, assume that in 2006 we improved our management of diabetes. We went from 48% getting fairly effective diabetes to 67% by 2012, and then we didn't do anything else. Well, believe it or not, that's good news. The number of people with diabetes goes up. It means we're keeping them alive. Next question, well, what happens if we actively identified people with prediabetes and went from about 20% of them actually being encouraged to make some lifestyle changes to up to 50%? And so that's between 2006 and 2012. And we just stop. Look at that. Now the prevalence significantly goes down. In other words, if you manage prediabetes effectively, and it's really quite theoretically simple. The study shows if we can get someone with prediabetes to do about 30 minutes of some kind of physical activity 5 days a week and lose 7% of body weight. We're not talking about losing that 100 pounds. We're talking about losing 7, 10, 15 pounds, that you can reduce the risk of going on to diabetes within a few years by 58%. Now we get to the real fascinating thing. What would happen if, starting in 2006, we got the obesity rate to go down to the 1995 level of only 27%? In other words, if we got people to lose weight, look at how dramatically that reduces the risk of diabetes. In other words, lifestyle changes make a huge difference if you want to dramatically reduce diabetes and save one whale of a lot of money in the process. And if we take a look at the mortality rates, you can see that all of these interventions make a difference. And the reality is you've got to do all of them well. But just managing diabetes and prediabetes is not anywhere near enough to solve the problems we have in our country. It's real simple. We don't have enough money in our entire economy to overcome the cost of all the chronic diseases that we're creating every day living in America. Okay, another cool slide. Looking at CDC data, they looked at a group of 157,000 adults who are asked 4 questions, at least these are the 4 we used. Are they not smoking? Are they maintaining a normal body weight? Are they eating at least 5 fruits and vegetables a day? And are they getting at least 30 minutes of some kind of physical activity 5 days a week? Walking, bike riding, dancing, vacuuming, swimming. Just getting off your butt and moving around, basically. Okay, pretty simple, right? You ready for this? 3% of Americans said yes. That slide right there, I think, has identified the problem we have in our country. Now, why is that so important? Well, about 70% of premature deaths are due to lifestyles. Now, this is the amazing thing. If you compare the group that said yes to those 4 things to the group that said no, there's some differences here. 36% reduction in the risk of cancer, an 81% reduction in the risk of heart attack, a 93% reduction in the risk of diabetes in this one study. In other words, there's something magic about walking and eating healthy that we just don't get. And as I mentioned, for people with prediabetes, if we could get them to do some very simple things, we could dramatically reduce their risk of getting diabetes. So what in the world is going on in our country? I have the answer. There it is. We don't understand how dramatically our lives have changed in the last 30 years. The amazing thing is this. If you're an athlete, if you go out and exercise every single day, but you go to work, sit in a desk, sitting on your butt really, in front of a computer screen for 8 hours, your running an hour after that will not overcome the damage which is happening to your body. A study that I saw about a week ago, this is I think a Newsweek magazine, they took a bunch of college students and they put a shoe on the right foot that had a 3-inch riser in it and gave them a cane. And for a couple of days they said, don't step on your left leg, which of course was kind of hard because you'd have to go like this. They did muscle biopsies after that, and after even a few days, they found metabolic changes in the leg that was not being used. Imagine what happens if you're sitting on your butt 8 hours a day for 40, 50 years, the cumulative slow effects that's happening. Okay, so let's analyze a couple of things real quickly. This is California. That's a burrito. This is a California story. It's about a guy who came in to see his physician in Los Angeles and said, I don't understand it. I am obese, I have prediabetes, I'm eating the same food my family has eaten for generations, and nobody in my family has ever had diabetes or obesity. Now, this is a pretty amazing physician because she figured out what was going on. She went and found out what his burrito consisted of, and then she went to rural Mexico to find out what his relatives used to eat. There's a slight difference. There it is. It is astronomically different what's between a 2-pound American burrito and a nice freshly made little Hispanic burrito in rural Mexico. So in other words, in rural Mexico they had fresh fruits and vegetables, they had whole grains. In America we have supersize. We have got lots of fat, lots of sugar and refined carbohydrates, and a lot of salt, an unbelievable amount of salt. And we don't have a clue that this is what we're eating every day. It's just, it's on the plate, it must be healthy. Okay, here's an example of a community who said, let's try to do something different. This community is called Albert Lea, Minnesota. And they had this crazy idea, let's change the environment in our cities so that healthy living is easy. They focused on 4 things. The first was eat well. The plant slant, that emphasis on stay away from the refined carbohydrates and the sugar, eat a lot more fruits and vegetables. Change a lot of things in the school system. Labeled healthy foods in the grocery stores. Got restaurants to serve at least one item that was healthy and an appropriate portion size, especially for kids. Encourage people to have their own gardens. And all kinds of simple things. Buy smaller plates and glasses. You eat less. And weigh yourself. It's the only way if you want to lose weight, if you don't weigh yourself every day, you're never going to make it. The other 3 things are fascinating. Get moving, find a purpose, community connections. So they had neighborhood walking groups. They had something called a walking school bus. There's 2 versions of it. See, 80% of our kids ride to school. It's not that they can't walk, it's that they can't walk safely. So you have parents walk with them, or you find a way for them to get around so that they can safely go to school. For the people that have to ride the school bus, it does not have to park in front of the front door of the building. You can always park a few blocks away and say, the school's over that way. And the other thing, it's interesting. Now, why did they choose these? It's because they discovered that these are 4 of the major characteristics for those areas in the world where people live the longest. Relationships, meaning, healthy living. And there's some others: brush your teeth, sleep enough at night. Not very many, though, and they make all the difference in the world. In 1 year, they made some differences. Now, as you well know, you do this, you figure 3 months later the world has changed. No way. But the people who participated lost some weight. You can go online, and based on your lifestyle, they can predict what your actual, realistic life expectancy is, and their life expectancy went up. Absenteeism dropped dramatically. But this, for 1 year, is not going to solve the problem. It's the beginning of a solution to a problem. Okay, real quickly, how do you change the work environment? How do you bring physical activity back into our sedentary lifestyles? How do you make it so that your employees have healthy places to eat and have healthy food choices? The other thing is that most large employers now have wellness programs, trying to, number one, is to have healthy employees. Duke University, their employees, the significantly obese employees had twice as high workers' compensation claims, 7 times higher medical costs, and lost 13 times more days from work. You cannot afford to have unhealthy employees. Cities, same thing. Now, it's interesting because we are hardwired to be more concerned about our financial health than we are about our physical health. And so we're trying every incentive we can imagine. We'll pay you for doing a health risk appraisal. We'll subsidize your gym membership. But it's getting interesting because there's some that are going the next mile, like Safeway in San Francisco. They have something called the Healthy Measures Program. There's 4 parts to it. It's voluntary. If you agree, we're going to weigh you. We're going to test you to find out if you're really not smoking. We're going to check your blood pressure, and we're going to check your cholesterol. For every one of those things, which is in a normal limit, we're going to reduce like about $250, $300 from your insurance premium cost for the year. So it's getting kind of interesting. All the things we're trying to figure out how to inspire people to do it. Lots of education, coaching, support, and of course now we're in the world of the apps, where, for instance, this is one of them, Optimize Me. You can do this alone, you can do it with some colleagues, you can set your targets, or it can set you daily targets. It will monitor what's going on, how many steps you took, or whatever it is going on. You can get virtual rewards. Your employer may throw some money behind it. All of these attempts to try to get healthy employees. Okay, now one other big important thing, and this is kind of the map of society based on health of human beings. So we start with individuals. And the fascinating thing about individuals is that we're incredibly resilient. We are constantly repairing, rebuilding, improving our bodies, if we let them. We are constantly fighting disease. We are, most of the time, destroying cancer cells before they ever cause problems. We heal very rapidly after we cut ourselves or whatever. And so our bodies are designed to stay healthy and survive. It's amazing. Thank God for that. But then we have the environment that we live in. And it's kind of interesting, all these factors that we're kind of immersed with. Obviously, genetics is something we can't control. The social determinants of health are huge. They are incredibly important, and most people don't have a clue. Access to education, access to a good job, access to financial security, not being discriminated against, feeling like you're a valued member of society, having a decent place to live. These are unbelievably powerful things that happen every day in our communities. If you live in a bad neighborhood that does not have the luxury of having these basic things, your life expectancy can be easily 10 years less. You can have 2 to 3 times, 4 times the risk of getting heart disease, cancer, things of that nature. And of course, the physical environment, do we have a community where you can get physical activity? Are there prevention and health promotion things? These are very important. Mapping this along, you have the individual risk factors. Am I taking care of myself? Am I eating a healthy diet? Am I getting physical activity? These physiological risk factors, do I have high blood pressure, high cholesterol, things of that nature? How resilient am I? And then, of course, things keep getting worse. Then you end up with disease and injury. And a lot of the disease and injury that we have is that when we took this healthy body and put it in the world that we live in, we've kind of done a lot of things to push that along. And that determines how healthy are we going to be? Are we really well, or do we have chronic diseases? Do we have disabilities? Are we going to die prematurely? The goal in society is to have a community that's thriving, well-being, resilient. The quality of life is high. They're able to work. It's very, very important in the global society where you're competing with everybody else. So here's the map. This is population health. There's healthcare. It's our industrial healthcare system. When we'll wait till something happens, and then we'll throw every technology we can at it. But healthcare more and more is doing secondary prevention, where let's identify the people with prediabetes, the ones who are not getting the physical activity, that don't know what a healthy diet is, the ones that have high blood pressure, and start working on that. But even that is kind of too late. What we really need is primary prevention. What are we doing about those social disparities that are causing so much problem? What are we doing to make our schools and our communities healthier? Now you can see that this is no longer a healthcare system. This is a society. So, what does all this mean? Number one, diabetes is a big deal. There's huge variations. You need to look at your state. Which counties have got serious problems? Which counties are doing well? Which county has a serious problem but is actually doing something about it? If you want to know where are the demonstrations that tell us what policies to make for the future, you've got to take a look at the counties which are making a difference all across the country. If I had money, I would find passionate people in a few counties who really cared and wanted to try something, and I'd give them the money to do it. And then I would find out which ones work, so that when another county comes along, I'd say, well, here are 5 counties that did something and it worked. Which ones do you think might work for your county? Because everything's different. We've clearly shown you that diabetes is not only big, but it causes a lot of complications and premature death. People tend to die, around 10 years prematurely from what their potential life expectancy is. Once diabetes is established, it's basically incurable. Even bariatric surgery lowers the blood sugar, but it probably doesn't reverse all those changes inside the body. So right now we don't have a cure for diabetes. So you guys have got the heart problem. The policies are buried everywhere in this. Where do you focus your energy? I'm going to tell you one last thing, because I think I've got 30 seconds. I keep struggling, how do you get the world to change? And then I thought about something that happened to me. I had a fellowship in vascular surgery in 1977 in San Diego. On Saturday mornings, my boss with the whole entourage would go make rounds on all our patients. He'd walk into a patient's room, sit down at the bedside, light up a cigarette, light up another one for the patient. So here you have the head of vascular surgery smoking in the patient's room and the patient smoking in bed, in the hospital. Now, for most of you, cannot even fathom that that was happening. That's what it was like. So what changed? In 1977, the CEO of the hospital couldn't possibly change it. It wasn't until the late 1980s and early 1990s before we got smoking out of hospitals. How did it happen? It happened when the patient said, I'm not going to a hospital where somebody's smoking in the bed next to me. And the nurses said, I'm tired of working in a cloud of smoke in this hospital every time I go to change a shift. So it wasn't the CEO, and unfortunately you got the same dilemma in government. Government doesn't very often lead, it only follows when the public gives them permission to do something. That's why it is so important for the American public to begin to understand what is going on in our society. And when a critical mass, sorry, I get emotional about this stuff too, especially when I haven't had much sleep. When a critical mass of Americans decide we're going to eat healthy food, we're going to start moving again, we're going to change the way we live, we're going to start addressing these things from the societal level, then we're going to change our country. If anybody's interested, there's a website where you can find out what's going on in your state.